So let's talk about some symptoms now. Let's take a moment and look at the differences between ALS, primary lateral sclerosis, and progressive muscular atrophy. Okay, and it has to do with which motor nerves are involved. So we had a nice picture here of the brain stem. So ALS is upper motor nerves plus lower motor nerves. The nerves in ALS become damaged, they degenerate, and they die off. And we don't know how to fix that. But with amyotrophic lateral sclerosis, it's both the uppers and the lowers. With primary lateral sclerosis, it's just the upper motor neurons that become involved. So when I talk about symptoms next, I'll talk about symptoms of upper motor neuron loss, and I'll talk about symptoms of lower motor neuron loss. And those people that just have PLS, they will only have symptoms of upper motor neuron damage. And then progressive muscular atrophy, that is only lower motor neurons. So in progressive muscular atrophy, the upper motor neurons stay normal and just the lower motor neurons are affected. Now, a lot of people wonder, where do we get the words amyotrophic lateral sclerosis? And again, that's right, it's a big word. And why do we call it Lou Gehrig's disease in this country? Because when Mr. Gehrig, very famous and beloved baseball player of the New York Yankees in the 30s, when he got the disease, nobody could say amyotrophic lateral sclerosis, but they could say that disease that Mr. Gehrig got. And they called it Lou Gehrig's disease because that was easier. The naming of ALS came from a very famous French neurologist in a series of lectures that he gave between 1868 and 1874. And what he observed was myotrophy, amyotrophic. Now, if we look at this, the components of this word, if you put in medicine A in front of something, that means without. And in this word, amyotrophic, we mean without trophic factors. Trophic factors are those factors in the area, in the environment, that are needed to nourish the environment and make sure that things happen that are supposed to happen. And what is the environment that we're talking about with this term? Myo. And myo is muscle. So here we have muscle that is without trophic factors. And that muscle then withers and loses its ability to work. It becomes weak. And that is a reflection of lower motor neuron loss. Now, the second part of the term amyotrophic lateral sclerosis is lateral and sclerosis. Now, lateral simply means off to the side. If you throw a lateral pass in football, it's going to be a pass to the side, right? And sclerosis, and sclerosis is a medical term that means hardened or scarred area, and anything can be sclerosed. Atherosclerosis is hardening of the arteries, for instance. In here, we're looking at lateral sclerosis in terms of the upper motor neurons. So this is a reflection of upper motor neuron damage. And what is seen in the spinal cord, if a doctor looks inside one's spinal cord, if you have passed away from ALS, you will see that these upper motor neurons do not go down the spinal cord willy-nilly all over the place, but they indeed go down the spinal cord like telephone wires in telephone cables, and they go down on either side of the spinal cord, in the lateral area of the spinal cord. So in the lateral of this area of the spinal cord, there is sclerosis. What they see from the nerves, the upper motor neurons that have died off, there's a scar tissue that's left, a hardened, scarred area. There's debris that's left. So Dr. Charcot put together lower motor neuron findings and upper motor neuron findings, and he named this disease amyotrophic lateral sclerosis. So that demystifies the disease. You can still call it Lou Gehrig's disease if you want to. It's more correctly termed ALS. And in France, out of respect for Dr. Charcot, who first named the disease, they often still call it Charcot's malady. So that's where the words come from. Now let's talk about symptoms. Symptoms of motor neuron disease, and in particular we're going to talk about symptoms of ALS, and we're going to divide that between the upper motor neuron symptoms and the lower motor neuron symptoms. So let's talk about the upper motor neuron symptoms first. And remember that if someone has PLS, they will only have upper motor neuron symptoms. And these symptoms, there's one that is a requirement for ALS. I'm going to star those symptoms that are required for a diagnosis of ALS. And that is brisk reflexes. So it's when the doctor hits near your joint with a hammer, then the joint moves more abruptly and more briskly. And the doctor can discern whether it's a normal reflex or a hyper reflex. So brisk reflexes. And then you can also think about some other areas that are reflexes other than just at the joints, at the deep tendons. You can think about laughing, crying, and yawning as reflexes. Someone starts to cry, you want to cry with them. I often yawn when I talk about this particular thing because the idea just gets in my head, and then we know that yawning is contagious.
Yeah.
And here I go, and I have no control over that. Exaggerated cry, laugh, or yawn. And it's a difference between the crying of sadness and the crying of this exaggeration. This is specifically called pseudobulbar affect. It's an awful name, but that's what the name it has. But it is an exaggerated show of emotion beyond what you feel. So one of the examples I use is a gentleman who might have been a tender-hearted guy and go to a movie, and it's a movie about a boy and a dog, and you kind of well up, and that's fine. You've got emotion, and welling up a little bit in your eyes is an appropriate response. And now the same guy goes to a similar movie, and it's a three-hanky. He's blubbering and he's sobbing, but he's got the same emotion on the inside. And people who have this often think they're crazy, but they're not. This is a reflection of damage to the upper motor nerves, and is seen in a number of diseases where upper motor nerves are damaged. For instance, it might happen in stroke or traumatic brain injury. And in ALS, about a third of the people with ALS will have this as a problem. And once it's recognized, it can be easily handled with just a touch of medicine. So that medicine will help someone to get back to their norm, their normal. So if this is a problem that you're having, you need to bring it up with your doctor. So it could be crying, laughing, or yawning. Could be one, two, or all three. And the yawning is a forced yawn. I've even had some people that get, kind of locked blocked their jaws and have to go to the dentist for this. But that's a real extreme. But anyway, it's good to know about it, because if you know about it, then you know that you're not crazy, there is a medicine for it, and you can do something about it if you wish. Spasticity or stiffness, so muscles that become tight, and they stay tight all the time, and this can impede movement. You can have normal strength in your legs, but if they're just really, really tight, you're going to walk with a stiff gait. It's hard to initiate the movement, and it can be uncomfortable. If your muscles are tight all the time, they can be quite uncomfortable. So spasticity is something that we see in quite a number of people with ALS. There are medicines for that, and your doctor at the ALS clinic will look for that in you when you have an exam. And then there's kind of like a spastic bladder. You've seen ads on TV. You can have urinary urgency. Urinary urgency or urinary frequency. Now, you're not incontinent. Incontinent really means that you wet yourself and you don't realize that you did that. But urinary urgency means that when you gotta go right now. There was a great ad campaign on a little while ago, gotta go right now. Yeah. And every time I saw that ad, boy, I wanted to go. But about a third of people with ALS will have urinary urgency or urinary frequency. And there's medicine to quiet that right down so that that doesn't become an ongoing problem. Now, let's look at lower motor neuron symptoms. And I'm going to star 2 of those. Remember, those things that I star are things that you must have for a diagnosis of ALS. So there's weakness, weakness of voluntary muscles, and then those muscles that are weak, that wither and they become atrophic. So there's atrophy. There's atrophy or withering of the muscle. So if you have brisk reflexes, weakness, and atrophy, then there's a high probability that you might have ALS. But it also comes with other symptoms. So when a doctor diagnoses ALS, he looks at a careful history. How did it start? What happened next? So the weakness that we see and the atrophy that we see usually starts in an asymmetric way. That is, if it starts in an arm or a leg, it's going to be a arm or leg and not both of them at the same time. It can start either distally, far from the main part of the body, or proximally with the larger muscles that are closer to the body. It can start, as I said before, in the arms or the legs, or it can start in the bulbar area, or it can start in the trunk or the breathing muscles. But with this disease, there is steady progression. It doesn't have relapses and remissions. The doctor looks very carefully at diagnostic tests to make sure or rule out other causes of this weakness and brisk reflexes, such as an impingement on the spine, a pinched nerve or a tumor. So MRIs are often used. And the EMG, the test where they poke you with some needles that are like acupuncture needles. Right. That is a test that really tells the story, along with the history, the neurologic examination, and the EMG in the light of doing other tests that come back normal. That will tell the story of ALS. So back to the symptoms: weakness and atrophy of voluntary muscles, cramping, Charlie horse type cramps. Now, we all get those from time to time, and cramps can be caused by a multitude of reasons. but in ALS we see them quite frequently. Maybe 70 to 80% of people might have muscle cramps. Doesn't mean, when I list these things, it doesn't mean that any particular person is going to have all of them, but these things can happen in ALS. So cramps, fasciculations, I love to say the word, I love to spell the word out, it's just such a cool word. But fasciculations are the twitchies under the skin. And what's happening there is that one nerve is firing off by itself. Instead of going with the group, that nerve is firing off by itself, and that it activates a muscle fiber all by itself, and you get a little twitch. So it's not a tremor, and it's not a jerk, but it's just a little twitch under the skin. And most people don't even know that they're happening.
Just like the heart beating? Is that
it can be kind of pulse-like, yeah. So fasciculations are very, very common. And then fatigue. Now, why do people get fatigued? In a normal day, I might use 10 or 15% of my muscle ability. If I would go out and run a marathon, which I can't physically do, but if I were to try, I would be using 100% of my muscle ability. But in a normal day, we use very little of our muscle ability. As someone with ALS becomes weaker and weaker over time, just going through normal daily activities is using a higher and higher percentage of their muscle ability. And it can be like going to the gym 3 times a day. And when you go to the gym, you get tired afterwards, you might have to rest afterwards. So normal daily activities can become like going to the gym and can require a rest period. So people with ALS, we know they get fatigued, and we know that they have to pace themselves throughout the day. So for instance, coming here and listening to a class that is an hour and a half or 2 hours, it's tiring. It is not the night to plan to go out to a big party. You know, pace your activities and not too many things in the same day. Allow for rest periods throughout the day, and you'll have more energy. So for the most part, these are the signs and symptoms that we see in ALS. And for each one of these, there are particular problems that can come up, and in the hands of an ALS specialist, there are ways to work with these problems to minimize them.